सो अभी हमारा थर्ड ट्राइमेस्टर, ओके, 7th 8th 9th ये वाले टाइम के बारे में पढ़ाई दिख रहा है ना स्लाइड?
हाँ हाँ दिख रहा है।
Okay, so it is visible, right? So let's
यस।
study the third trimester. So the third trimester is the final stage of pregnancy. Okay, this is the culminating, like it will change into labor, and then the birth of the child happens. By this point, she has probably gained 10 to 20 pounds. Like we divide 10 divide by 2.2. It's like 9 to 12 kg she should gain the weight, okay, in her pregnancy period. If it is more than 12 kg, again, it will cause obesity. So it will cause more problems in her. If she is not getting like 9 kg also, that means a baby will be low weight, or she will have like malnutrition kind of problem, like baby also may have. So 9 to 12 kg is the most ideal weight she should gain by the end of third trimester. Okay, so although only a quarter of this weight is actual baby, so if she is she gain 9 kg, then the baby weight is 3 kg around. Okay, so sorry, the quarter, 1/4. Okay, so not 3 kg, more than 2 kg, less than 3 kg. If she is 12 kg, then the baby's weight is 3 kg. Okay, the rest is mostly the supporting system that keeps the baby alive. So the weight of placenta, water inside it, okay, baby, it all includes in that, and some adipose tissue in her body, right? So that all include 20 to 30 pound, which is 9 to 12 kg in average. Extra weight can cause great discomfort. So we don't recommend, if she is getting more than 12 kg, then we don't recommend her to gain more weight. Okay, she should be careful. She should start eating like low carb food that time. The pressure of the crowded uterus on the internal organs, okay, result on heartburn. So it is common. Heartburn, if she is suffering from heartburn, it's not a problem. It's common. Okay. Frequent urination, common. Lower back pain, it's also common. Cramping in the front and side of the abdominal muscles, and shortness of this breath. So many pregnant women, they got these problems in their third trimester. The only thing is, once they practice yogic practices, it will soothe them. Like the problem will come, but in a very minimal way. The large unyielding mass of her belly causes interrupted sleep. So she cannot have a deep sleep. Okay. Difficulty moving, and clumsiness also. The mother has unstable joint due to the hormone relaxin. So because of the relaxin, she can stretch her body. Okay, so joints, these are unstable, which allows her pelvis to widen so that she can deliver, and mainly experience dizziness and swelling in her hands and legs because of the slowed circulation, which is caused by the progesterone hormone. So her circulation will be slow. She will feel dizziness when she is standing from sitting position. Okay, and her hands and the joints in her hands and leg got swollen. So these all are common in pregnancy. Okay, so that's why there is a thumb rule. If like a pregnant woman is sitting, you should go and sit with her. If she is giving food in a sitting position, you should sit and take the food. If she is standing and giving the food, you should take the food in the standing position. Even yogis, sadhu, santa, saints, they should even follow this rule with the pregnant ladies. They cannot say, you respect me when I'm sitting, give me food by sitting when you are standing also. Okay? Because from sitting to standing, standing to sitting, she can feel dizziness. Did you see the another slide? Or it's the same slide in your? side. Khushbu,
Yeah, it is another side.
change, right? Okay.
Yes.
So in this, sorry. In this last couple of months, the baby prepares for the delivery. Sorry, the body prepares for the delivery. So she should prepare her body. She should have trust on her body. Okay, during this time. The mother will experience Braxton Hicks contraction or sporadic tightening of the uterine muscles. In practice, for the muscle contraction during labor that pushes the baby out. Okay, she will start having contraction. The baby will drop down in the uterus towards the end of the 9 month and she feel difficulty in walking and sitting. Once the baby is downward, like moving downward, then it will be difficult in walking and sitting as well. In the last few weeks, her cervix will begin to slowly open, dilate, like 1 finger dilation, 2 finger dilation, 3 finger dilation, we say that way. Okay. And her pelvic floor will soften until she goes into labor, okay, usually indicated by membrane rupturing, okay, water breaking, water breaks, water start coming out, or contraction becoming intense and more frequent. So the interval between two contraction will be like decreased when the labor is starting. Okay, so during the first, we'll study again in the different stage of labor, first, second, third stage. Okay, so that time we'll study. Okay, so contraction are becoming intense and more frequent. All these dramatic change, okay, coupled with discomfort and anxiety about giving birth, can make the last trimester stressful to her. So what she will think during the last trimester? When I will get the baby, how I will get the baby, it will be surgery or it will be normal. So these things give her stress because she doesn't have.
At first, Mona, I think in today, मतलब आजकल ये fear हो सकता है, but at our times, this was not fear.
Yes, Didi. At
Because
your time,
most of the deliveries happen, most 90% delivery happens normally.
Normal, yeah. In your time, it was like
Uh-huh.
the pregnant woman was more focused. Okay,
Yeah.
right now, because of so many sources online and this and
Yeah.
that,
Yeah.
people are having so much stress because of these reasons.
Yeah.
Yeah.
Correct.
So this is true because we are having problem. That's
Because of social media, I will. Because of social media, they are getting confused.
yes.
What to eat, what not to eat.
Yeah. Because of that reason, we need guidance during the pregnancy right now. In your time, there was no pregnancy yoga or something like that, right?
Yeah.
Because it was not needed. Right now, it is needed because of all these problems we are facing. Right? So let's move. So this is the stomach, okay? This is the belly. You can see when it is in 3rd month, how big it will be. 4th month, how much upside. This is the navel region. Okay, so it grows all the way up to the diaphragm till the 9th month. Okay, now what are the physical changes in the woman? Okay, in the pregnant ladies, weight gain, obviously, decreased energy and fatigue, or in some case increased energy. Somebody like a 2nd trimester is like high energy. 3rd trimester, some people still have high energy, some will start like having low energy also. Increased urinary frequency in the last month or two last month, okay, as baby is moving downside, strong baby movement, vaginal discharge, difficulty in balances as the center of gravity changes. So balancing will be a problem. Difficult sleeping because she cannot lie down in her savasana. She has to do this, right? So difficulty in sleeping, constipation, because large intestine doesn't have space right now. It is like, compact like this. Okay. Because of that reason, it will be like difficult for her to throw the toxin, I mean the unwanted material out from her body. So constipation start happening in this time. Increase heartburn, indigestion, flatulence, because right now the stomach is increasing and all the way her belly is
Yeah.
all the way up.
Digestion happens. Digestion.
So these are the physical change in the mother. Breast enlargement, headache, occasional faintness or dizziness, nasal congestion, bleeding gums, increased appetite. Somebody will eat more, somebody will eat less also. May decrease in the last month also. Food craving and aversion, fluid retention in ankle, feet, hand and face, so that she will have the swollen,
Yeah, yeah.
swollen joints. Varicose vein, because the blood pressure is already low. Hemorrhoids, shortness of the breath, abdominal ache and uterus stretches, itchy belly, leg cramps, back pain, sciatica. Okay, because right now the arch is too much, right? Because of that, rib pain, urinary incontinence, clumsiness, Braxton Hicks contraction.
What is this Braxton Hicks concept?
I had explained you that time.
Okay, I forgot.
So these are known as the false labor.
What?
False labor. False labor. Labor.
Okay,
Labor.
yeah, got it. Got
Okay, you got it right.
Got it.
You have the practical also.
it.
Okay, leaking breast. Sometimes some people
Yeah.
start having like milk production before the delivery also. Heaviness in the abdomen because food is not getting
Yeah.
digested properly. Increased pressure in the pelvic in the last month and difficulty in walking. Now, mental changes, forgetfulness. Some woman will develop forgetfulness, right? Decreased concentration, increased thought of child birth apprehension, like fear, like how I will give birth, it will be normal, when the baby will come, right? So many things about the future. General worries and anxiety that baby will be okay, healthy or safe inside or not. Okay, his heartbeat is still going on, it is stopped like that. Okay, dreaming about the baby, increased thought about the baby, boredom and fatigue about pregnancy, like I'm tired, you come fast, come fast, come fast, like that.
Yeah, this happens.
Right, eagerness for pregnancy to be over, this is the same thing.
Yeah.
Excitement that baby is coming, relief it's almost over. Like that. Oversensitivity to others' opinion. Okay, especially when due date is nearby, like people will say this, they will tell their experience, bad experience, right? And then that happened, that happened, like that. Okay, and impatience and restlessness in the last month and fear of birth. Now what happens in baby inside? By 32 weeks, the baby is about 41 centimeter long and weight is around 1800 gram. That means almost 2 kg. Okay, the baby is inhaling amniotic fluid to exercise its lung and practice breathing. So breathing is not happening, but lungs are totally functional right now. That's why once the baby is born in 7th month, they can survive because of that reason. Okay, so amniotic fluid is the fluid which is going through the umbilical cord. By 36 week, the baby is 47 centimeter and 2800 grams. So these are the general, like average information. Okay, so some baby are like more weight, some babies are again low weight also. By the end of 36 week, the baby is classified as the full term. Okay, now if 36 month baby is like ready to birth, ready to born. Okay, the birth can happen in 37 week, 38 week, 39 week, 40 week. Some people like 2-3%, they go like 41, 42 weeks also. Okay, which means that it can be born anytime from then on and not be classed as premature. So if the baby is born in 7th month, we call it premature. Okay. So right now 9 month is over. So like 9 month is started. Okay. So the 40 weeks means 9 month plus 8 days. Okay. So 8 month is completed. 9 month is running. So baby can come anytime. Okay. By 40 weeks, which is due date of which only 5% of the babies are born. Okay. The baby may be 50 centimeter long and 32 gram by weight. So if like complete 40 weeks, baby can be little bit bigger than the 37, 38, 39, 40, 39 up to 39 weeks time. Now, what the pregnant ladies should consider as important. Okay, important things to remember. By the 3rd trimester, the belly will have expanded significantly, and many things will need to be adapted. So she should accept that first. Okay, and then she have to adapt. She should not adjust. She should accept. Okay, accept and adapt. Adaptation is a positive word and adjustment is a negative word actually. So adjustment is like your mind is not ready. Okay, I will adjust. Okay. Adapt is okay. It will be good for me. So she should adapt so many new things. Each woman is different. Some will feel very comfortable and active. Some will feel tired. So depending upon their body, their temperament, their mental condition, their physical condition. Okay, some people have pain and have difficulty in moving also. So a yoga practice will have to be adapted accordingly to the need of that woman. So it's not compulsory for all the women that they should do asana. Some people are totally on bed rest when they come to you. Their doctor will say, no, don't move here and there, right? So that time you cannot say, I'm a yoga teacher, I have learned yoga asanas and I will teach you asana anyway. No. Okay, so we cannot say anything. It's according to the condition. Okay, need of the body also. So one asana can be very comfortable for one pregnant ladies. The same asana will be very difficult for other also. So we have to use our brain that time. We have to work intellectually after being a prenatal, postnatal yoga teacher also. Okay, so many poses will have to be stopped or adopted. So many changes, like if she is doing without blocks, now need of block, need of ball, ring. Okay, everything is needed right now. If she has a tendency of preterm labor or complication in her previous pregnancy, okay, certain asana will need to be avoided, particularly squatting poses like Kali goddess pose, Malasana. Okay, these poses should be avoided if she has like preterm labor in the past. There is no reason to stop yoga in this trimester. It can be practiced up to until the day of labor, and even during the labor also she can practice yoga. Okay, but with care and awareness under the guidance. Now, specific focus and the yoga practice. This time we focus more on breathing and less on asana because she may have restricted mobility. Okay. In fact, breathe work or pranayama is a crucial part of 3rd trimester practice. So pranayama becomes very important in the 3rd trimester. It encourages relaxation as well as help her to focus more. It can be done on its own in a favorite hip opening position such as Supta Baddha Konasana, okay, reclined boned angle pose with pillow supporting the knees, okay, or it can be used during asana also practice to encourage the focus. She should be advised to explore poses that help her relax but also find the strength. So strengthening as well as relaxing asanas should be encouraged to her. This work will later serve her during the intensity of birth. The biggest concern with asana in this trimester is protecting the joints and maintaining balance. So body is imbalanced and joints can be, overstressed. So she should protect her joint and maintain the balance also. Even an experienced yogini will have to adapt to her quick weight gain and unbalanced shape. Okay, even those who are practicing yoga, they should also experience these kind of things. Basic standing and balance poses such as Uttita Trikonasana, extended triangle pose, Uttita Parsvakonasana, okay, extended side angle pose, Virabhadrasana 1, 2, okay, and Vrikshasana. So right now I'm also learning Marma, okay. So Marma we cannot give to pregnant ladies. Marma is totally restricted, okay. And some asanas, they activate the marma point. They stimulate the marma point. So Vrikshasana actually I'm removing from my practice, because Vrikshasana actually stimulate marma of our body, and marma stimulation is totally unhealthy for the baby. Okay, so marma stimulation should be totally avoided during the pregnancy. And from asanas also, some asanas, they stimulate the marma. So I'm removing Vrikshasana right now, okay? So I will remove from my note also. Because Vrikshasana is one of the very important asana which stimulate marma also. Are good for building strength in the legs. Like the more you study from the different field, right? The more you make yourself, knowledgeable, starting like, refining yourself. So I'm in the process of refining, okay. Reestablishing proper alignment in the spine and encouraging blood circulation. But be sure to do them near the wall or with the chair. She needs support because she may lose the balance. Challenging poses are not of the menu, but breath is very important and the sequence is equally important also. If any time she finds her breath is compressed, okay, compromised, she needs to shift the shape of the pose. She does not need to come out of the pose, but she can shift, like she can make her comfortable, okay, or take rest so that she can keep the smooth, steady breath. So breath is very important in her third trimester. If she is feeling some difficulty in breathing in her asana, so she can adjust her. I mean, she can adapt the variation and she can make it easy, or slowly she can come back from that asana, and from next time she has to avoid that. Hip opener, okay, such as Baddha Konasana and Utthita Konasana, seated wide angle forward bending pose, is also important in this trimester. So in forward bending, she is not going all the way, okay. She is like making her spine straight and catching the finger. If she is not catching the finger, she can catch the ankle or shin bone or even calf or even knee also. Are also important in this trimester because they will help to relieve ache in the lower back and create space around the pelvis. The poses also help to release the lumbar spine, okay, and open the hip joint, and are good position to make the mother more comfortable during the labor too, because she is preparing for the normal delivery, okay. Pelvic tilts can alternatively tone by lifting and soften by lowering the pelvic floor, like Marjari Asana, okay, cat pose, and help shift the baby lower to the uterus, and may even encourage proper positioning for the birth, head down, face back, like the normal in the normal delivery. If head comes first, it is very easy for mother and the baby. If leg come first, then it is difficult, right? Pranayama practice should be continued. If possible, increase the pranayama practice. Neti, yoga nidra, meditation, visualization, and mantra all can be practiced and will be helpful to bring her emotional balance. Visualization and meditation on the birth can help to remove the fear and make one feel more comfortable about the process. So this much from the previous note. Okay, this one will be uploaded. I have finished one. So how I'm categorizing like note 1, note 2, note 3, like that. Okay, so I'm opening the second note. So this is again about pregnancy. Okay, there are some something about yoga, some knowledge about yoga, as well as some common questions pregnant ladies can have in their mind. Okay, let's continue. Share the slide. Okay, so pregnancy yoga, again, some questions and some answers about pregnancy. So why yoga is necessary? Why like we are encouraging like you should do yoga? Okay. Yoga is a way of developing self-reliance and calmness of the mind during the pregnancy, which is very important because if she will take stress, it will directly hamper the baby. Practicing yoga asana with quiet mindfulness, okay, develops a strong, supple body and the ability to breathe deeply and relax completely. Before starting prenatal yoga, it is necessary to ask the doctor also. Like if she comes after getting pregnant, then she should ask her doctor either she can do or not. If she has come before like pregnancy and she is practicing yoga asana class with you, and once she got pregnant, then only you should be careful. Okay, pregnancy doesn't mean that body is ill. Okay, it is a natural process and she cannot do any work. It is not like that. It's a natural process and the female body is prepared for it. Okay, it's just that care should be taken as there are a lot of hormonal changes in the body. So this is not any kind of disease or illness. Okay, it is a natural process, but we need to be careful. That's all. Okay. So there are a lot of hormonal changes which leads to mood change, insomnia, okay, etc. Along with that, there are many physical changes in the body. We already know a little bit about it, right, in our basic class, which can lead to lower back pain, sciatica, nerve stretch, varicose vein, swollen feet, etc. So many things happen in our body. Yoga is beneficial in solving all the problems faced during pregnancy, starting from the first trimester till the last trimester. Yoga also makes hormonal balance, okay, hormone balance, which makes the lady comfortable and balanced throughout the pregnancy. The focus on prenatal should be on making the pelvic area strong apart from the other problem faced by the lady. So our main goal is she can have normal delivery, okay, natural process, natural birthing process. Okay, to support that, our pelvic area should be strong, and pelvic area is the one which will hold the pregnancy, so that if her pelvic area is strong, she can hold the baby till the 9th month. Okay, if pelvic area is not strong, then there is chance of preterm baby also, which is again not natural. Apart from asana, pranayama also play a very important role in balancing the mind and the body. Pranayama, they connect our body with the mind. Okay, so pranayama is the bridge between the body and the mind. A good session of pranayama can be, okay, of 10 to 15 minutes daily. Okay, at least. If anuloma viloma pranayama done daily, it leads to a normal delivery. So anuloma viloma nadi suddhi pranayama, it is very helpful because it will totally balance the both hemisphere of the brain. Okay, that balance stage will give the normal result, natural result. Okay, as this pranayama balance the body and strengthen of the nerve and nervous system as well. For those who cannot do asana, okay, only practice of pranayama, mudras, meditation and relaxation also help them to some extent. Prenatal can be divided into 3 trimesters, okay, in 3 months interval. Depending on trimester, we can schedule the prenatal asana, which I will give you like weekly asana, like which week we can give her what asana. Okay, some asana can be done in all 3 trimester with the, and some in the specific trimester. Some we can do for like few weeks, some we can do for the whole time also. Okay, what are the precaution when she is doing prenatal asana? Okay, never let the lady hold the breath. No holding of breath. Okay, no matter how easy the asana, okay, or the exercise may be, if the lady is not comfortable in that particular asana, discontinue with it. If she is not feeling good, if it is so much easy asana, it is sukhasana also, it is vajrasana also. Okay, it is easy for you, it is easy for her before pregnancy, but after pregnancy, if she feels no, then no, it is not for her. All the moment will be smooth, no jerking. Okay, no backward bend, because the arch is already there. Increasing arch will have the arch, like a deeper arch. So no backward bending. If it is really required in the case of lower back pain, then a slight back bend with support of hands on the back, if it is required only. Don't make the body lie on supine position. Okay, lying face upward for a longer time, as it will reduce the oxygen flow to the fetus. So sideways, you will be relaxing on the sideways. While relaxing on supine, make the body turn on one side, preferably left or any side in which the lady is comfortable. So because of the varicose vein, we turn towards the left side during the to avoid the varicose vein, because because we don't want to put more pressure on the vena cava. Okay, that's why left side is preferable. But if she is not comfortable on left side and she is comfortable on right side, we can say, okay, you can use the right side. But our focus should be on the left side. No abdominal pressure. Okay, press will be there in any asana. In balancing asana, place the body closer to the wall or to the near, okay, be near to her to support, so that lady doesn't fall or get imbalanced. So wall, chair, all these supports we should be providing her. In some case, the fetus is breech. Okay, in that case, okay, normal delivery is not recommended. So breech baby, breech fetus, I will teach you in detail later. Right now I will tell you, like, there are 4 different kind of breech also, like complete breech, so complete breech, flank breech, transverse breech, footling breech. That means complete breech means the head is totally upward. Okay, flank breech is hip is coming first. Okay, when the baby is coming, like the baby's hip is coming, head is still up, but the hip is nearby the cervix. Transverse breech is baby is transverse. Okay, and then footling breech mean one leg will come first, and then another leg, and then body will come, and then head. So during the breech condition, either of them, like either 4 of them, it is better to go for the normal delivery. But if we know it's in the breech position, okay, during the 7th month or 8th month, then we can, with the practice of asana, we can bring to the normal position also. Okay, but if like the baby is in breech, she is not doing any asanas or anything from the very beginning for the breech baby, she did not go to the hospital and check the position, then that time we cannot do anything. Okay, so whatever the doctor says, we have to follow that. Prefer the lady to sit on the floor and do the asanas. Okay, you can spread a mat or thick seat. Sitting in cross leg is very good position for a pregnant lady. So Sukhasana, she can sit in Sukhasana and do asanas. It is said that whenever the lady thinks and does, okay, it is diverted on the child within the womb. Okay, whatever she does, it will go to the baby. This is why it is said that the mother to be should remain happy and calm during the pregnancy period. Yoga really does wonders in connecting the body and the mind and balance them. It makes her understand the fact that happiness is within us. No outer situation makes you balance or unhappy. So she will, with the practice of yoga, she will know the source of happiness is inside her. Through pranayama and meditation, we can release the stress and relax the mind, which eventually leads to normal delivery and healthy baby. It affects the behavior of the child as well. So these things we will study in Garbha Sanskara. So it's very important to practice yoga through the pregnancy for the healthy delivery and the healthy body. Now let's start with the first trimester. If the lady is already doing yoga asana or any physical workout, then you can make her to do with the joint opening exercise or yogic practices from the first month onwards. If she is yoga practitioner, she can do. If she is not, then she should wait until the end of the first trimester. That means in the second trimester only, she can start. And in modern time, many women will come when they are already in the second trimester. So if somebody comes in the first trimester, ask them, they do practice or not. They have done any yogic practice regularly in their life. If they will say no, we do like occasionally, then ask them to wait till second trimester. Okay. So in second trimester, yogic practices to strengthen up the legs and the pelvic areas will be started from the second trimester. At the same time, focus should be on the spine, okay? Because from now onwards, the fetus will grow further and the weight of the fetus has to be carried by the spine. You can give her some spinal strengthening asana like Kati Chakrasana, Trikonasana, Konasana, Marjari Asana, Markatasana. We can teach her to make her spine strong. Her legs, her spine, and her pelvic floor muscle. We have to focus on these things. As the abdomen start coming out by the end of second trimester, at times the ladies start feeling bad due to the feeling of obesity. Okay, weight is gaining. So she will feel little bad. This is a normal process and make mother to accept the fact. So she should accept her body is growing. She should accept it. This is normal. This is natural that she will be gaining weight. In third trimester, okay, the third trimester is the last trimester of pregnancy before little one arrives. In this trimester, her baby gains maximum weight. Okay, now the good pelvic stretches are given because we are preparing her for normal delivery. The central of gravity of the lady has also changed. Be careful as the lady can get imbalanced easily. Make her to do asana with the support of wall or near the wall. Asanas like warrior 1, warrior 2, butterfly, half Baddha-Konasana, full squat with support etc. can be practiced. By the end of third trimester, the pelvic region becomes flexible. With that, the large intestine also becomes flexible and the lady may feel constipated due to this. Okay, it is very normal. So if she will say, I'm feeling constipated, it is normal. Like you have to say, it is normal, it is normal, it is normal, like that. Okay. If she comes with some problem, ask the lady to increase the water intake and have fiber-rich food. Due to the baby's weight, the pressure on the bladder is more and the lady feels to urinate again and again. And this is also very normal. Varicose vein, tiredness, uneasiness can also be felt by the end of third trimester. Just try to relax the mother to be by pranayama and meditation. You can give some short counseling session as well to ease the mother to feel better. Okay. As she would be going through lots of mental stress and the mood swing. So you should be a friend, you should be a sister, you should be a mother, you should be a coach. Okay, you are not a yoga teacher that time. You should play all the role in her life. Okay, now let's go in little deep. Okay, yoga for the first trimester. The first 3 months of pregnancy are a time of major changes in the body. Long before any outward manifestation, okay, begins to get in the way, of doing poses, these feel different on the inside. So outside it doesn't look any changes, but inside it may change. So we need to be very careful during the first trimester. This is the challenge of first trimester yoga. From outside, it looks normal because she doesn't have a big belly. Okay. She comes happy in the morning, maybe in the yoga session, because of the mood swings, she start crying. So anything happen inside, okay, which is not obvious from the outside. That is the main challenge. But this is also the challenge that is at the core of any yoga practice. Listening to your body. Listen to your body all the time. And pregnant women have the most intuition than the other time. Okay. Follow her intuition. Follow her intuition. You may think you know yourself and what your body can do. Okay, she may think that. But on any given day, she have to really tune in and respect the cues your body gives to you. So if she says like, I know my body, I know everything about my body, I can do this much backward bend or forward bend, or, you know, if she can say, if she is saying also, but the core thing is she has to be careful. She has to be totally careful with her body. Taking the attitude that your body knows best, okay, and will guide you is also the best way to prepare for the childhood. So intuition comes. Intuitions are very strong during the pregnancy. So she should follow the intuition when practicing the yogic practices. Okay, so she will suffer from so many problems. Okay, so morning sickness, if she's experiencing nausea in the first trimester, this is her body telling that to take it easy. Okay, so if like vomit is coming in the morning, nausea and vomiting is happening in the morning, which we call morning sickness, then she should accept it first. If she has been attending yoga classes regularly, if she is your, you know, regular yoga practitioner, you are your regular yoga teacher. Like some people get pregnant by chance. Okay, they don't know till the time they got, you know, they miss their period, right? Okay, give give yourself permission to miss class. If she wants to miss class, then she can miss class, or take a less vigorous class if she doesn't feel well. Okay, going to public. She may feel not comfortable discussing about her pregnancy with many people in the first trimester. So it is not good to talk also to all the people, to many people. Just keep it inside your family, because 20% of miscarriage happens during the first trimester. We don't know. We are either in this 20% or in that 80%. But it is important to tell your yoga teacher, okay? So that you're pregnant, so that she can assist you with modification. Ask the teacher to be discreet if you are not ready to go to the public also. So if you come to the yoga, if she comes to you during her like preconceived, right? You have to guide her through the preconceived 3 months, at least 3 months or 6 months, whatever time she gives, right? The couple gives. And once she comes after getting pregnant, after getting conceived, then you should be careful, like which trimester she is, what she can do, what she cannot do. Is she a regular practitioner? So many things you need to consider. So those who are new to yoga, who doesn't know yogic practices, many pregnant women are looking for low impact forms of exercise and may take up yoga for the first time. So they, the people who are going to gym or something like that, right? Then they will say, okay, we'll do yoga. Yoga is easy, right? And then they come to yoga in their first trimester, but they don't know anything about yoga. The best thing to do in this situation is find a prenatal yoga class at your local yoga studio. So the pregnant lady, she should not do yoga by herself. She should find a prenatal yoga teacher. Okay, not only yoga teacher, prenatal yoga teacher, because prenatal yoga teacher can understand the situation, understand the body, because she knows what's going on, right? If we are just a yoga teacher, 200 hours yoga teacher, and we don't know any contraindication for pregnancy, we don't know what asana should be done in the first trimester, second trimester, third trimester, then they will not guide us properly. Okay, she can start attending prenatal classes as early in her pregnancy if she likes. However, if she is not feeling well, it may be better to wait to start a yoga regimen like yoga class until your morning sickness has passed, which is usually in the second trimester. So if like for the new people, new person, they should wait until the second trimester. That is the best thing. For the new one. If they are new one, don't take it. Don't take risk. Don't take them in the first trimester for your asana class. You can teach them little pranayama, little mudra, meditation, relaxation, yoga nidra, you can give them. But for the asana class, ask them to wait for second trimester. Now for the experienced yogis, yoginis. Even if you are not experiencing morning sickness, you may find that your regular class feel a bit too intense. If you are a regular practitioner also, there is no morning sickness, but still you are feeling little intense. So this is that same time prenatal class seem to be little gentle. So if you are practicing yoga for a long time, now you should shift to prenatal class. Now your regular yoga classes stop for a while. One solution is to decide which class to take on a given day, depending on which you feel that day. So if you feel something good in that day, you can still do. But it is the best thing is prenatal yoga teacher should guide you in a very better way than the regular yoga teacher. You can also she can also start to incorporate some prenatal adaptation into her regular practice. Make sure to tell her, like she should tell her regular yoga teacher also what you are doing and think of your pregnancy as her permission, sleep to do that practice that is right for you, for her on that day. That means she should talk with the yoga teacher. So I'm pregnant right now. I can do this, I cannot do this, or only the prenatal yoga teacher again can guide, because prenatal yoga teacher, they know which asana is good for which week, which asana is not good for which week, right, Anjali Didi? So
Yes.
we are doing we started teaching from 2020, right? Till this time, when we were just teaching the regular yoga class, we did not know. We said like, you should not do Sirsasana. When Sirsasana comes or when inverted asana comes, we are like, oh, this is contraindication. Like that, only the regular teacher knows. Once we study the prenatal, postnatal yoga teachers training, we have some experience working on few women, then only, right, we can give the better guidance. Like today,
3 months we will become prenatal yoga teacher.
yeah, today only I came to know that some asana, they stimulate the marma point, and I have to remove these asanas.
Yeah.
Right? This is the fine tuning. Only the fine tuned person can give you protection and protection to your baby during the asana class. As your pregnancy progresses, you may start to find that the prenatal yoga class, so this is very important. Classes you attend and more suited to your changing body. And prenatal yoga teacher, they can feel, most of the prenatal, postnatal teacher are already experienced mother. If they are not mother also, they feel, because the training in offline session, when we'll do asana and online session also, we can do that. Actually, we did asana with the baby bumps inside, by putting the clothes so that the body has restriction for movement, for like forward bending movement. The either it is blanket or even cloth or whatever, but it restricts. So with the feeling, the yoga teacher, I mean the prenatal yoga teacher will teach you. Okay, recommended poses. Okay, hip opener like pigeon, warrior second, triangle, Ardha Chakrasana, Ardha Chandrasana, Pada Konasana. Okay, and knee to ankle will help to create the flexibility that will make giving birth easier. Yoga can be very beneficial for the pregnant woman. It helps you breathe and relax, which in turn can help you adjust to the physical demand of pregnancy, labor, birth, and motherhood as well. It calms both mind and the body, providing the physical and emotional stress. Okay, stress relief your body needs throughout the experience of pregnancy, and taking a prenatal yoga class is a great way to meet other moms to be also and embark on the journey together. So if you are in your area, if you are taking the offline class, okay, on the ground, on the studio, then you will meet other mothers also which are going through the same period, same time. Then you can talk, you can share. So it will be a different environment for you. If you are doing online class also, you can share all your problems, all your things with your prenatal yoga teacher, so that she will also be a very supportive person. So for a prenatal yoga teacher, you cannot be a prenatal yoga teacher only. Okay, you are the mother, sometimes you are the sister, sometimes you are the coach, sometimes. So you have to play all the roles according to the necessity of that day.
Will it safe to take online prenatal yoga?
Yes, you can give one to one. Not like, you cannot give the prenatal yoga classes should be 1:1. Like, you should not collect like 4 or 5 pregnant ladies together and then, okay, let's do it like that. No, 1-to-1 you can give. Like, I have my teacher, okay, who is doing a PhD in pregnancy yoga. Most of her classes are online and she always give 1-to-1.
And
And now, she has trained more than 120 ladies till
wow.
this time, and her rate is 80% of the students she taught, they are giving normal delivery. Like 20% they have to go for cesarean, because the thing is, some come early in the pregnancy period, some come later in the pregnancy period. So if we cannot work from the very beginning, then we cannot change so many things also. That is the reason.
80% is also too much. 80%,
Yes,
80% normal delivery.
I did not get your question.
You are telling only 20% of
80% are giving normal delivery, like her success ratio
80%
is
are giving normal delivery,
Yeah.
and only 20% was not
cesarean. Yeah,
taking the normal.
cesarean, yeah.
The rate is high.
Yeah, that is very good.
That is very
Yeah, now if we go to the hospital, there is chance of 50-50. Like in an average, 50% they do normal delivery, 50% they do cesarean, right? So she has increased from 50 to 80, which is a very good within 120 participants. Okay, so taking a prenatal yoga class is a great way. Okay, she should do that. Now she need to take few precautions. Okay, if she is attending a regular yoga class, which is not specifically the prenatal class, okay, be sure to tell the instructor you are pregnant and which trimester you are in. Like, before becoming prenatal yoga teacher also, okay, some people come to us also, right? And then they say we are pregnant, then we have to go for very gentle for them. But it is the best thing is she should find any prenatal postnatal teacher. Now many teacher, many yoga teacher, they are interested in prenatal postnatal. So if she will find any prenatal postnatal teacher, that will be very great. If not, then also she should say that I'm pregnant and teacher should be taking care of her. That precaution she need to take. Don't do any asana poses on your back. Okay, after the first trimester, it will reduce blood flow to the uterus. So the asana on the supine position should be avoided from the second trimester and third trimester. Avoid poses that stress the muscle too much, particularly the abdominal. Okay, you are more at risk for strain, pull, and other injuries right now because the pregnancy hormone, the relaxin hormone, okay, spelling is RELAXIN, okay, not G, which allows the uterus to expand, also softens connective tissue. Okay, so ligament tendons may also have problem when she is stretching too much. From the second trimester onward, when the center of gravity really start to shift, do any standing position with your heel on the wall or use a chair for support to avoid losing the balance and risking injury to yourself and to your baby. So she should be, because in the second trimester and the third trimester, the center of gravity change. Okay, balancing will maybe problem. So she should always take the support of the wall or chair or people like that. She should not do anything by herself without the support. Okay, working out in one overheated room, okay, overheating could endanger the health of the growing fetus. So she should be doing, okay, in a very calm, cool temperature, not in a over, like hot yoga, like we say hot yoga, Bikram Chaudhary's yoga, 42 degrees Celsius temperature, that should be completely avoided. She should do in the normal room temperature. Okay, when bending forward, hinge from the hips, leading with the breastbone and extending the supine from the crown of the head, okay, down to the tailbone. This allow more space for the ribs to move, which makes easier to breathe. So once she is going forward, okay, she should not go like this. Okay, she should first pull her spine. Spine should be elongated. It is not necessary she should touch the ground. She can put the block, okay, and then just go downward. Keep the pelvic in a neutral position during poses by engaging the abdominals and slightly tucking the tailbone down and inwards. It helps to relax the muscle of the buttock, okay, the gluteus, and the hip flexors, which can help reduce or prevent sciatic pain down the back of the leg, okay, a common side effect of the pregnancy. It will also prevent injury to the connective tissue and establish the pelvic region. I will finish these precaution and then we'll stop for today. Okay, if she's bending forward while sitting, place the towel or yoga stripe behind your feet. Okay, hold the both in. Okay, bend the hip and lift the chest. Okay, she should lift the chest to avoid the compression on the abdomen. If your belly is too big for this movement, try placing a rolled up towel under your buttock to elevate the body and open the legs, okay, about hip width apart to give the belly more room to come forward. So when we are practicing, like, we'll understand more about this. Okay, when practicing twisting pose, okay, twisting more from the shoulders. Okay, she should twist from the shoulder region, not from the abdominal region. Okay, and back, then from the waist. Okay, waist twist should be avoided, okay, to avoid putting any pressure on your abdomen. So far, okay, go only so far in twist as feeling comfortable. Deep twists are not advisable in the pregnancy. Listen carefully to your body. If you feel any discomfort, stop immediately. You will probably need to modify each pose as your body changes. A good instructor can help you customize your yoga to suit the stage of pregnancy you are in. So go for a experienced prenatal, postnatal, so that she will help you a lot. Okay, so this much for today. I'm stopping here.